Hi, my name is Bobby Bonser. Welcome to Waynesburg University Athletic Training Preceptor Workshop. This year, as you know, we're trying a new format online. We're going to try doing this where basically I'm just going to record. I'll send you a PowerPoint along with the PowerPoint that I'm going through. And then we'll look at the quiz later. I'll show you how to access that, which will be online. So this is really going to be the new format for our preceptor education from here on out. If you have trouble at any point, please let me know, or if this link doesn't work. I'm going to try to make this fairly brief, but when we get into the important stuff like what the students are required to do and evaluations, I'm going to slow down a little bit, so hopefully we can all get on the same page with any changes or updates that are being made with the new regime here. As many of you know, we have a new program director, Joe Schaefer, and so we're also on the horizon and the cusp of a master's degree switch with athletic training in general. So we have put that proposal in and had it approved by our administration. So we are working on putting that together for the future. So a lot of new things on the horizon. So we're going to do our best to communicate to you all through all these changes. And as always, we thank you very much for helping our students in the past and in the future really learn more about athletic training through you. This is really their window into athletic training. They get to see and learn from you. So we really appreciate everything you've done. Clinical education, as we're aware, is hugely important for each student. We can tell them all the things we want to in class, and we hope that some of it sticks, but a lot of that is the foundation, and a lot of the application and critical thinking is where they're doing that in their clinical sites with you all. And so we really value your role in our program. That's why it's important that we're all on the same page. So this preceptor training, the purpose is to make sure that we are all communicating, that you know what our expectations of you are as a preceptor, and also for us, if there's anything that we can do, we want to highlight that for you. So we want to make sure that we're constantly communicating and that we're updating as we make program adjustments. So first of all, we want to talk a little bit about the responsibility for preceptors, for you all to educate students. We want to talk a little bit about the tools necessary for our athletic training students for them to make their experience good. Just a basic understanding of the program and any changes that have been made in the past year, and also update you on any new standards from Katie or current standards that are changing. So that's the purpose of this presentation. It should take about 20 to 25 minutes. And you can see our learning outcomes here. And again, just the broad overview of where we're going. So Waynesburg University, as you're all aware, is a Christian liberal arts private university in southwestern PA. We're all pretty much in close proximity, so I'm not going to spend time explaining every detail here. We did have a provost change that you should note. So Vice President for Academic Affairs and Provost is Dana Baer. Jacqueline Kaur left this year. And so Dana is our new provost. We're very excited about the prospect of her working and helping the institution to grow. And she's very supportive of our program and our shift to the master's degree. We are accredited, as you know, by Katie. Our next site visit is coming up in 2019-20. And we are staff that consists of many different departments. And if you need to get in contact with anyone in particular, you can see this list here, and I'll give you contact information at the end of these PowerPoint slides. We have a variety of affiliated clinical sites that were already established before I came in and before really for the last 10 years. We've had quite a few. And what we're trying to do actually is hone these sites down a little bit to where we can do a better job of visiting each site and making sure that our students are getting a great education at each site. And so this year, which we'll talk about a little bit later, I'm going to be doing a lot more evaluation of our preceptors and sites to make sure that the education that our students are getting are high quality. Our program has been around since been accredited since 1998. It was approved in 1989, and as I mentioned earlier briefly, our next site visit is coming up. So at that time, we will actually, the plan is to have a master's degree in the works and be working on getting that approved for 2020 and on. So this is on the horizon, and we will obviously be updating you all as we make those changes. Our mission is really to make sure that our students have the skills and knowledge necessary to be a good athletic trainer, to provide opportunities for them to learn professional and competence in the profession. This happens again a lot through the clinical education sites that we're sending them to through you guys. And so again, we really appreciate that. We want to prepare our students for a successful career. This obviously starts with passing the BOC exam. That's one of our main objectives. We want to make sure we're above a minimum of a 70% pass rate, but we're hopefully more around the 90 to 100% rate. And we want to really make sure that our students are good at being professionals, communicating their ideas, and obviously taking care of patients in patient care. Our academic program, as many of you are aware, is split into 2 semesters of observation, getting your feet wet. Our students will take just some basic intro classes in those years, and then their sophomore year is when you guys will start to see them. So sophomore year, they'll head out, a lot of them, to high schools where you are at or other sites. Physical therapy, usually we send our students out there junior and senior year. And then they do a lot of their rotations at WAYNESBURG Sports with preceptors here during their junior and senior year as well. That's in the advanced program, which are the last 3 years of their undergraduate education. Here's a basic layout of the classes that our students take. You can look at this on your own time. I'll send you the PowerPoint. If there's anything here, we are looking for guest lectures all the time. So if there's anything here that you feel like you might be able to offer clinical expertise, perhaps a manual therapy technique, we really encourage you to let us know if that's something you're interested in, and we would love to have you come out and talk to the students about your area of expertise. Clinical experience, just in general, we want our students to make sure that the concepts they're learning in the classroom are being echoed in their clinical experience. So this is really the ideal situation. We want them to be able to apply their knowledge, not just review it in a book. And again, I can't state it enough. This is why these rotations are so important. We want to make sure they're making decisions with you on the things that they've already been approved on. We're going to talk about that in just a minute, but we want to make sure that if they've been approved, for example, for an upper extremity eval, that they're able to go through that with your supervision and learn from their mistakes. So here's just a basic requirement of what we require of the freshmen, 2.7 minimum. Most of our students are around that or above that, and they do this freshman year of observation on campus. They go through a formal interview, they provide references and writing samples, and this is how we determine our inclusion criteria for acceptance to the program. And we really encourage our students to get a variety of clinical experiences. So we want to encourage them to go out to family medicine practice, physical therapy, pharmacology. We want to expose them to a lot of interdisciplinary roles and how to communicate basically healthcare medical terminology with other healthcare professionals. Students must maintain their 2.7 and pass comprehension exams to maintain their status within the program. So for clinical education guidelines, we really want to make sure that our students are getting a lot out of their experiences, and this involves them, what we expect of them. And I wanted to briefly tell you what we expect of our students so that you know when they might be doing something that is not in line with what we expect. So we expect each student to attend the clinical education experiences, program meetings, in-services, guest lectures, anything that's going on outside of the program per se. We want them to really make that connection between theory and practice to make their learning stick. Their ATP handbook has a lot of different things that we expect of them, but I wanted to highlight just a few. If they are not meeting a minimum of 5 clinical hours a week, we need to know this. So if they're not showing up, we expect them to be doing more than 5 hours, but 5 hours a week is a minimum. Professionalism, general professionalism, including HIPAA code, not talking about patients while they're in the room, making sure they're maintaining confidentiality, general professionalism, OSHA standards. These are all things that are important, and we need to know if our students are not doing those things in your presence. Dress code, same thing. We expect all our students to dress professionally, not provocatively, and also making sure that they're not just wearing t-shirts or things that don't distinguish them as healthcare professionals. We expect them to communicate with you and with ourselves, with me for the clinical sites. We want them to be active learner. If they're not asking questions or if they're sitting with their arms folded in the corner and not being engaged, these are things that we would like to know as well. So hopefully they will reflect on the evaluations that you do of them, or you can communicate with me through email or phone or anytime I come in for a site visit, and hopefully we can talk about those things and remedy. We want them to practice skills. We encourage them to practice what they're using, and if they aren't applying those skills, that's also a problem. So we want to make sure they're being bold enough to try the things that they're learning and not just sitting there passively again. We encourage students to review what they did with their preceptors each day, and also their responsibility for their internship is to evaluate the clinical site, the preceptor, and their courses. This is something I want to note because it can be a big issue. Hopefully it's not a big issue, but we encourage students to use their phones if they're using them for the purpose of education. So if they're looking up something about anatomy after they've looked at a specific patient case or something like that, according to our policy, that's fine. However, if you are having trouble with students using it for purposes other than educational, for example, social media, any type of app like a game, or even texting a lot, these are all things that are concerning, and again, we should know about this. The students, again, this is kind of hand in hand with professionalism. We want to make sure that they're demonstrating professionalism in their clinical sites. Last note, obviously we need to practice what we preach. So if you expect them not to be on social media, then we would expect that of you as well. I think that probably goes without saying, but just want to highlight that. And if any of these students are in violation of these policies, then we have violation policies in place to deal with that. So most of this is just communicating with Preceptor and with myself and Joe Schaefer, and we can come to a solution where the student is either on probation or they are basically aware and then coming back in line with what we expect. Shifting gears here a little bit, we just want to talk about preceptor briefly qualifications. We just know that all of our preceptors, all of you, are healthcare professionals. You must be credentialed, and this will be something that we need updated credentials annually. So I want to make sure that I get those from you in August before we start our students going out to those clinical sites. Must not be enrolled in a professional athletic training program. So this is just a stipulation to make sure that there are divided interests and that you have enough time to educate our students. What we expect of you, we really expect, again, to supervise. This is direct supervision. This is not send them out on their own. This is making sure that they're always within eyesight, but you don't have to micromanage, obviously. We don't need to be looking over their shoulder all the time, but we do expect that they're not on their own quite yet. So they need that feedback of what they're doing well, what they're doing not so well, and what they're messing up on pretty badly, so that they can correct that. So this is their time to learn. Along those lines, providing ongoing instruction, opportunities for them to get better. Clinical proficiencies. Students will have checkbooks that we will send with them out to sites often, and you may get them asking if you can check off proficiencies. Ideally, these proficiencies will be done in the course of your rotation over the months that you're with them. However, if they are not done, and you don't, for example, see a student naturally doing a lower extremity evaluation that you can check off for them, then you may provide clinical scenarios to where the student has to pretend or demonstrate those skills in a scenario-based checkoff. So this goes along with facilitating that learning environment in a practical way. Again, ideally, hopefully you're not spending a lot of time making up scenarios. Hopefully we can get our students exposed to enough that you can check them off as they happen. Preceptors must receive this education, so this is part of being a preceptor, and this will occur annually. So I will send out either this video, or if things change, we'll send out a new video for making you aware of responsibilities and ongoing education. Communication, I'm not going to go through each of these individually, but one of the big things is expectations, which I'll talk about in the next slide here. Really sitting down with students and making sure that they know what you expect of them from the outset is really important, because this is where we see a lot of breakdown in communication. If students don't know what you expect of them at the site, then they don't really know when they're messing up or not doing things that you want them to do, and vice versa. Hopefully you can get the students' expectations of what they need from you, what they need to learn, what they want to learn. Might even be a good idea to sit down with them. Again, hopefully this is like an hour-long meeting talking about schedules, when the students' classes are, any conflicts that you might have, and what the students want to learn. Just ask them, what are you interested in? And this might be a good starting point to really get to know them and know what they are needing to learn in their clinical rotations. So as I said before, direct supervision is important. The students are only able to practice the skills that they've been taught in class, so this is really important. If they have not learned ultrasound, then they can't perform this in their clinical site. If you have a question about what they've learned at any point, you can reference the class list on this PowerPoint that I showed you earlier, or always feel free to email me or Program Director Joe, and we'll be happy to tell you what they can and cannot practice in the clinical setting. One of the things that we encourage from preceptors is obviously promoting critical thinking for our students. Really promoting higher level problem-based learning, which is asking questions of the students and not giving them the answer. So progressing from asking what to so what and to now what is kind of a good progression for clinical education. And this is really the purpose of the whole thing, and hopefully this is where it's fun for you, where you get to really quiz our students, and we want to see them squirm a little bit. We want to get them uncomfortable, not in a bad way, but uncomfortable to the point where they have to think through why they are doing the things that they're doing and not just doing things rotely. That also comes in with the point of not using the students just to fill water bottles or do a lot of work. The students are not there to work primarily, they are there to learn. And so this is their clinical rotation, and that's what we expect. Clinical education, we really encourage you when you're educating the students to incorporate any research that you've read. We encourage you to tell them to seek out new information and try to incorporate that into their clinical rotation. So this is a huge part, as you're aware, of our profession advancing. Along with this, patient outcomes, very important. we're going to have our students take outcomes in their clinical sites, range of motion, but also pain scales, quality of life scales. We want to make sure that all those things are in place so that they can justify in the future if they're getting patients better, why, and if they're not, why. And this also sets us up for third-party reimbursement in the future as a profession. So this is just another last reminder on the education topic of Bloom's taxonomy, coming from these understanding and remembering to getting more so on the side of applying, analyzing, creating, evaluating. Professionalism and AT, I'm not going to talk about each of these individually, but I've already said professionalism encompasses OSHA, HIPAA, as well as just the general air. Are they treating people with respect? Are they taking care of the duties? Are they active? Are they engaged? These are all things that have to do with professionalism that you'll be evaluating. So shifting gears here, this is where we're getting to the practical point. So students, as I said earlier, are required to do 5 hours minimum. We really expect to see them do more than that, even up to 20 a week. And this is where it's at your discretion. So when you sit down with the student and talk about your expectations at the beginning of the semester, we really encourage you to set up a schedule. They're required to give you their schedule. And so if you can talk about what time you expect them to be there, before practices, before games, for instance, what you expect them to do if they're helping you with setup, what they need to do there. So this is really important when it comes to not only hours, but other things. All hours must be approved by you on A-Track. So this is a new stipulation and something that if you struggle with, please let us know. At the end of this presentation, I'm going over briefly what the format of that looks like and how you will approve those hours. So the student evaluations are completed on A-Track. So you will evaluate the athletic training student, and the athletic training student will use A-Track to evaluate themselves. This is where you will sit down with them 3 times a semester and go over that evaluation. The evaluations really they are for us to have a record of what's going on and address any shortcomings, but they're meant to be used actively. So if you sit down with them, which we require, preceptors need to sit down with the students and talk about the evaluation so that we can say, okay, so you haven't been showing up on time. Why is that? And here's why I rated you low. Or your lower extremity evaluation wasn't very good. You messed up on not taking a thorough history, and here's some ways that we can improve that in the next month. So that's why we do 3 times a semester, so that we can catch anything in the middle that might be a habit or a bad habit starting to form and correct that for the students. And that's why, again, it's important not just to fill out the evaluation, but to talk with the student about it. The evaluations themselves are graded on a 10, 8, and 6 Likert scale. It's kind of an interesting Likert scale, a little bit different than you might be used to. I'll give you the example of hours reporting. If you're checking the student off on the Likert scale and you're rating them on shows up on time for clinical practice. If they show up on time and they've never missed a day or come late, then that's going to be a target. They've met your expectations. If they have missed a few days or they've been late 1 or 2 days, but it hasn't been a huge issue, then you may check them as acceptable. And if they've been late more than that, or it's a habit that they're not correcting, then an unacceptable rating would be appropriate in that situation. And so this is kind of how we expect preceptors to fill out for each skill. Skill like a lower extremity evaluation, our juniors obviously are not going to be up to par with seniors. However, we expect them to be proficient in their own right. So just keep this in mind when you're evaluating them. A junior level target rating is going to be different than a senior level target rating. So we want to make sure we're all on the same page when we're rating our students. The eval process, you can see here, they will sit down with you with the schedules and their strengths and weaknesses analysis, strengths, weaknesses, opportunities, threats, and then they will complete their evaluations and they will evaluate you and the clinical site at the end of the semester. The clinical coordinator and myself will be coming, scheduled visits this semester, so I'll be in touch with you. I really want to make it a point to get out there and just do a face-to-face so I can get to know you all better. And the purpose of this is obviously to communicate, to evaluate the site, to make sure our students are learning effectively at the clinical sites that we're sending them to. And so we want to make sure the student is a learner there, not a worker again. They can do some work, but again, they're primarily there as a student learner. And they want to be learning rehab, they want to be learning evaluation, acute emergency care, all of those things. So again, this is just another way of breaking down how the evaluations will take place. Lastly here, I just want to take you through the practical, how this looks on A-Track. You can click on this link on the PowerPoint that I send you, and there's a nice helpful video on how to work A-Track if you're still confused. If not, I can help you when I come out in August and gather your credentials and quiz scores. Once you log into A-Track, so if you don't have your login, first of all, please email me. I can send you your login and password, and then you can reset your password. You will be given a menu, and this menu here, this one and your main menu are really going to be the only ones you're concerned with. You click on your menu, score proficiencies or approve hours. To approve hours, it's very simple. It shows up when the students put their hours in and a little note about what they saw, and you either click approve or not approve. And we encourage you to do this at least on a monthly basis to make sure they're up to date, if not weekly, if you can remember that. When you click on your main dashboard or portfolio, you'll see the links that are blue are the active evaluations. If you click on that, that is where you'll do your evaluations 3 times this semester of the students. If you only have our students for one sport, let's say football, then you'll only be doing this evaluation twice, once at the beginning and once at the end of the rotation. And when you click on the form, this is what you'll see. You'll select your name, the student's name, your clinical site, and then you'll evaluate them on all different professional and clinical attributes. And again, this is the scale that I explained down here: target, acceptable, unacceptable, not observed, or not applicable. And one last note there, I really encourage you, if you have not seen the student do something, please select not applicable or not observed. We definitely don't want the students to be rated on something that they haven't been doing. So this brings me to my last point, and this is really where we get to say a big thank you to you. We really appreciate everything you do, and we know that there's not a lot that we do for you per se. A lot of this is just you looking after our students and the profession, helping to educate future athletic trainers. That being said, we do want to provide you with some opportunities if you would like to take advantage of them, such as guest lecturing, for instance, coming to maybe an in-service. Let's say you might want to learn the Mulligan technique if you don't know a manual therapy technique, and we're teaching those skills to our students one day or to each other. We really encourage and invite you to that so that you can continue your education. We also offer a free symposium for EBP credits. So for all athletic trainers in the spring, please take advantage of this opportunity for free EBPs. And again, this is just a way to try to say thank you for all that you do for our students. And we really appreciate that. So where from here? The next step is to take a quiz. The quiz is on A-Track under your portfolio and will be available from mid-July through August. And this quiz does need to be completed with an 80% or better before our students come out to the clinical rotation. The quiz is concerning all the stuff that we just talked about. So You will have access to the PowerPoint and this video. If you need to rewatch or need to look at those things again, please visit those resources and use those to take your quiz. Again, just thank you so much for all that you do for our students. We really appreciate you, and we know that they do too. It really reflects on their evaluations. So thank you. If you have any comments, questions, concerns, even about the format of this training, please let me know. We're always looking to improve. My email is listed there. You can also find my office number online, and hope to be in touch shortly for our site visits and quiz and getting your credentials. Those are the next 3 steps for us. So thank you again, and have a great day.